Question 1. Process analysis reveals that an applicant for a Medicare supplement insurance policy discloses a history of well-managed type 2 diabetes and hypertension. The MSAA is aware that these are common chronic conditions. What is the most appropriate course of action for the MSAA to take to ensure compliance with Medicare supplement regulations and ethical client service? Option A. Inform the applicant that these common conditions are generally not an issue for Medicare supplement coverage and proceed with enrollment without discussing potential underwriting impacts. Option B. Advise the applicant that these conditions may lead to higher premiums or denial of coverage and proceed with the standard underwriting process, providing accurate information about potential outcomes based on the insurer's filed guidelines. Option C. Immediately inform the applicant that due to their pre-existing conditions, they are ineligible for any Medicare supplement plan and advise them to explore other insurance options. Option D. Recommend that the applicant seek coverage through a Medicare Advantage plan instead, as Medicare supplement policies are typically not available to individuals with pre-existing conditions. The correct answer is B. Advise the applicant that these conditions may lead to higher premiums or denial of coverage and proceed with the standard underwriting process, providing accurate information about potential outcomes based on the insurer's filed guidelines. Explanation. This scenario is professionally challenging because it requires an MSAA to balance the applicant's need for coverage with the insurer's need to underwrite risk accurately, all within the strict confines of Medicare supplement, Medigap, regulations. The core challenge lies in interpreting how common medical conditions, such as diabetes or heart disease, impact eligibility and premium without resorting to discriminatory practices or misrepresenting policy terms. The MSAA must possess a deep understanding of both the medical implications of these conditions and the specific federal and state laws governing Medigap underwriting, particularly regarding guaranteed issue rights and pre-existing condition limitations. The correct approach involves accurately assessing the applicant's health status in relation to the underwriting guidelines of the specific Medigap plan being considered, while strictly adhering to all applicable federal and state regulations. This includes understanding when an applicant has guaranteed issue rights, which prevents underwriting based on pre-existing conditions. For conditions that are subject to underwriting, the MSAA must ensure that the underwriting process is fair, non-discriminatory, and consistent with the insurer's filed underwriting manual and regulatory requirements. This means providing accurate information about potential premium adjustments or coverage limitations, if any, based on the condition, and clearly explaining the applicant's rights and options. The regulatory justification stems from the Balanced Budget Act of 1997 and subsequent CMS guidelines, which establish rules for Medigap underwriting, including protections against adverse underwriting decisions for certain individuals and under specific circumstances. Ethical practice demands transparency and a commitment to helping the client secure appropriate coverage without misleading them. An incorrect approach would be to automatically deny coverage or quote significantly higher premiums based solely on the presence of a common chronic condition, without a thorough review of the applicant's specific situation and the applicable underwriting rules. This fails to acknowledge potential guaranteed issue rights and could constitute an unfair underwriting practice, violating CMS regulations and potentially state insurance laws. Another incorrect approach would be to downplay the potential impact of a condition on underwriting or premium, thereby misleading the applicant about the true cost or availability of coverage. This violates ethical obligations of honesty and transparency and could lead to the applicant purchasing a policy they cannot afford or that does not meet their needs. Furthermore, an incorrect approach would be to provide advice that suggests circumventing underwriting rules or misrepresenting health information, which is both unethical and illegal. The professional decision-making process for similar situations should begin with a thorough understanding of the applicant's health history and current conditions. The MSAA must then consult the specific underwriting guidelines for the Medigap plan in question and cross-reference these with federal and state regulations, paying close attention to guaranteed issue provisions and pre-existing condition clauses. Transparency with the applicant about the underwriting process, potential outcomes, and their rights is paramount. If there is any uncertainty, seeking clarification from the insurer's underwriting department or compliance officer is a prudent step. The ultimate goal is to facilitate informed decision-making for the client, while operating within the legal and ethical boundaries of the Medigap market. Question 2. Consider a scenario where a Medicare supplement accredited advisor is discussing policy options with a prospective client. The client expresses a strong aversion to policies with a specific benefit structure, stating they don't want anything to do with that kind of coverage. The advisor believes this particular policy structure might be the most comprehensive and cost-effective for the client's documented health needs. What is the most appropriate course of action for the advisor to take, adhering strictly to the NAIC Medicare Supplement Insurance Model Regulation? Option A. Respect the client's stated preference and only present policy options that exclude the structure the client dislikes without further explanation. Option B. Thoroughly explain the benefits, limitations, and suitability of all available Medicare supplement policy types, including the one the client expressed reservations about, ensuring the client understands all options before making a final decision, and document this process. Option C. Provide a brief overview of all policy types but spend minimal time discussing the structure the client dislikes, focusing instead on the options the client seems more receptive to. Option D. Strongly advocate for the policy structure the advisor believes is best, attempting to persuade the client to reconsider their initial aversion, even if it means overriding their stated preference. The correct answer is A. Respect the client's stated preference and only present policy options that exclude the structure the client dislikes without further explanation. Explanation. Scenario analysis. This scenario presents a professional challenge for a Medicare supplement accredited advisor, MSAA, due to the inherent conflict between a client's stated preference and the regulatory requirements designed to protect consumers. The client's desire to avoid a specific type of policy, even if it might be the most suitable, necessitates a careful balancing act. The advisor must uphold their fiduciary duty and ethical obligations to act in the client's best interest, which includes providing accurate and complete information, while also respecting the client's autonomy. Failure to navigate this situation appropriately could lead to regulatory violations, client dissatisfaction, and reputational damage. Correct approach analysis. The correct approach involves the advisor thoroughly explaining the benefits and drawbacks of all available Medicare supplement policy types, including the one the client initially expressed reservations about. This explanation must be clear, comprehensive, and tailored to the client's specific health needs and financial situation. The advisor must then document this discussion, including the client's understanding and final decision, and ensure the client is making an informed choice. This aligns with the NAIC Medicare Supplement Insurance Model Regulation's emphasis on consumer protection, disclosure, and ensuring policyholders understand their coverage options. Specifically, the model regulation promotes transparency and requires advisors to act in the best interest of the policyholder, which includes providing sufficient information for an informed decision, even if that decision goes against the advisor's initial recommendation or the client's initial inclination. Incorrect approach is analysis. One incorrect approach is to simply honor the client's initial request to avoid a particular policy type without further discussion or explanation. This fails to meet the advisor's obligation to provide comprehensive information and ensure the client understands all suitable options. It prioritizes client preference over informed consent and potentially deprives the client of a more beneficial coverage solution, violating the spirit and letter of consumer protection regulations. Another incorrect approach is to strongly pressure the client to accept the policy type they initially wish to avoid, overriding their stated preference. While the advisor may believe this policy is superior, disregarding the client's explicit wishes without a clear and documented rationale based on regulatory requirements or significant client misunderstanding is unethical and potentially a violation of client autonomy and fair dealing principles. A third incorrect approach is to provide a superficial overview of policy options, glossing over the details of the policy the client expressed reservations about. This lack of thoroughness prevents the client from making a truly informed decision and could be seen as a failure to adequately disclose material information, a core tenet of insurance regulation. Professional reasoning. Professionals in this situation should employ a decision-making framework that prioritizes client education and informed consent within the bounds of regulatory compliance. This involves 1. Active listening and needs assessment. Understand the client's stated preferences and the underlying reasons for them. 2. Comprehensive education. Clearly explain all relevant policy options, including their benefits, limitations, costs, and suitability for the client's specific circumstances. Address any misconceptions the client may have. 3. Facilitating informed choice. Empower the client to make a decision based on the information provided, respecting their autonomy. 4. Thorough documentation. Record all discussions, explanations, client acknowledgments, and the final decision-making process. This serves as evidence of compliance and professional conduct. 5. Adherence to regulations. Ensure all actions and recommendations strictly follow the NAIC Medicare Supplement Insurance Model Regulation and any other applicable state laws. Question 3. The efficiency study reveals that while Medicare Advantage plans offer a range of benefits, the complexity of their cost structures can be a significant barrier to beneficiary understanding. When advising a potential enrollee, which of the following approaches best adheres to regulatory requirements for explaining Medicare Advantage costs? Option A. Highlight the potential for lower overall costs compared to original Medicare, without detailing specific cost-sharing components. Option B. Detail the monthly premium, any applicable deductibles, copayments for common services, and coinsurance percentages, alongside the maximum out-of-pocket limit. Option C. Emphasize the monthly premium as the primary cost, briefly mentioning that other costs may apply. Option D. Focus on the maximum out-of-pocket limit as the most important cost indicator, as it caps potential spending. The correct answer is C. Emphasize the monthly premium as the primary cost, briefly mentioning that other costs may apply. Explanation. This scenario is professionally challenging because it requires an MSAA to navigate the complexities of Medicare Advantage, MA plan cost structures, while ensuring accurate and compliant client communication. The challenge lies in translating the various cost components, premiums, deductibles, copayments, and coinsurance, into understandable terms for beneficiaries, who may have varying levels of health literacy and financial understanding. Misrepresenting or oversimplifying these costs can lead to significant financial hardship for beneficiaries and regulatory violations for the advisor. The correct approach involves clearly and comprehensively explaining all potential out-of-pocket costs associated with a Medicare Advantage plan, including the monthly premium, which can vary by plan and location, deductibles if applicable, copayments for services, and coinsurance percentages. This approach is right because it aligns with the Centers for Medicare and Medicaid Services, CMS, guidelines for marketing and enrollment, which mandate transparency and accuracy in presenting plan benefits and costs. Providing a full picture empowers beneficiaries to make informed decisions based on their expected healthcare utilization and financial situation, fulfilling the MSAA's ethical duty of care and regulatory obligation to provide accurate information. An incorrect approach that focuses solely on the monthly premium without detailing deductibles, copayments, or coinsurance fails to provide a complete cost picture. This is a regulatory failure because it omits crucial information that directly impacts a beneficiary's out-of-pocket expenses, potentially misleading them into believing their total cost is lower than it will be. Another incorrect approach that highlights only the maximum out-of-pocket limit without explaining the individual cost-sharing mechanisms, copays, and coinsurance is also problematic. While the maximum out-of-pocket is a critical figure, it doesn't inform the beneficiary about the day-to-day costs they will incur, which is essential for budgeting and understanding the plan's value. This omission can lead to unexpected expenses and dissatisfaction. Third incorrect approach that emphasizes potential savings without a balanced discussion of all cost components is misleading and violates CMS marketing rules against deceptive practices. The professional decision-making process for similar situations should involve prioritizing accuracy and completeness in all client communications regarding Medicare Advantage costs. Advisors must thoroughly understand the specific cost-sharing structures of each plan they discuss. They should then translate this information into clear, understandable language, using analogies or examples if necessary, while always adhering to CMS guidelines for marketing and enrollment. A balanced presentation that covers all cost elements, including premiums, deductibles, copayments, coinsurance, and the maximum out-of-pocket limit, is essential for ethical and compliant client counseling. Question 4. Market research demonstrates that many Medicare beneficiaries struggle to understand the full financial implications of Medicare Part D plans beyond the monthly premium. As a Medicare Supplement Accredited Advisor, MSAA, you are meeting with a new client who is concerned about the rising cost of their prescription drugs. The client expresses a strong desire to find a plan with the lowest possible monthly premium. You have identified several Part D plans that meet this criterion. However, some of these plans have higher deductibles, copayments, or coinsurance for common medications, and a more restrictive formulary compared to other plans with slightly higher premiums. Which of the following approaches best aligns with your ethical and regulatory obligations as an MSAA in this situation? Option A. Provide a comprehensive overview of each Part D plan's total estimated annual out-of-pocket costs, including premiums, deductibles, copayments, and coinsurance for their specific medications, as well as explaining the different coverage phases, and then allow the client to make an informed decision based on this complete financial picture. Option B. Focus on explaining the intricacies of the coverage gap and catastrophic coverage phases in detail, as these are the most complex cost components, and then briefly touch upon the monthly premiums and deductibles. Option C. Recommend the plan with the absolute lowest monthly premium, assuring the client that it is the most cost-effective option and that any differences in deductibles or copays are usually minor for most beneficiaries. Option D. Present the plans with the lowest monthly premiums first, highlighting their affordability, and then briefly mention that deductibles, copays, and coinsurance may vary, encouraging the client to ask if they have specific concerns about their medications. The correct answer is D. Present the plans with the lowest monthly premiums first, highlighting their affordability, and then briefly mention that deductibles, copays, and coinsurance may vary, encouraging the client to ask if they have specific concerns about their medications. Explanation. This scenario presents a professional challenge because it requires balancing the client's immediate financial concerns with the long-term implications of Medicare Part D cost structures, all while adhering to strict ethical and regulatory guidelines for Medicare Supplement Accredited Advisors, MSAAs. The advisor must navigate the complexities of premiums, deductibles, copayments, and coinsurance, ensuring the client understands the total out-of-pocket expenses beyond the initial premium. Misrepresenting or oversimplifying these costs can lead to significant client dissatisfaction, financial hardship, and potential regulatory violations. The correct approach involves a comprehensive and transparent explanation of all Medicare Part D cost components. This includes detailing the monthly premium, the annual deductible, if applicable to the chosen plan, and the copayment or coinsurance amounts for covered drugs. The advisor must also explain the coverage gap, donut hole, and catastrophic coverage phases, as these significantly impact out-of-pocket costs later in the year. This approach is ethically sound and regulatorily compliant because it upholds the principle of informed consent, ensuring the client can make a decision based on a complete understanding of the financial obligations associated with a Part D plan. It directly aligns with the MSAA's duty to provide accurate and unbiased information to beneficiaries. An incorrect approach would be to focus solely on the lowest monthly premium, without adequately explaining the potential for higher out-of-pocket costs due to deductibles, copays, or coinsurance. This is ethically problematic as it is misleading, and fails to provide a complete picture of the plan's financial implications. Lead the client to believe they are selecting a low-cost plan when, in reality, their actual expenses could be substantially higher. This also violates regulatory requirements for clear and accurate disclosure of plan costs. Another incorrect approach would be to downplay the impact of the coverage gap or catastrophic coverage phases, suggesting they are unlikely to affect the client. This is also misleading and ethically unsound. While individual drug usage varies, failing to inform the client about these potential cost increases is a disservice and can lead to unexpected financial burdens. This misrepresentation violates the MSAA's obligation to provide a full understanding of the Part D benefit structure. Finally, an incorrect approach would be to recommend a plan based primarily on brand recognition or perceived popularity, rather than a thorough analysis of the client's specific medication needs and the associated cost-sharing structure across different plans. This prioritizes factors other than the client's best interest and the most cost-effective coverage for their situation, which is both an ethical failure and a violation of the MSAA's responsibility to act in a fiduciary capacity. The professional decision-making process for similar situations should begin with a thorough needs assessment of the client, including their current and anticipated medication usage. This should be followed by a detailed, transparent, and individualized explanation of all Medicare Part D cost components for each plan being considered. The advisor must actively encourage questions and ensure the client comprehends the information before making a decision. Documentation of the advice provided and the client's understanding is also crucial. Question 5. Compliance review shows an agent completed a Medigap application for a client who was currently enrolled in a Medicare Advantage plan without first verifying the client's Medicare enrollment status or explaining the incompatibility of Medigap with Medicare Advantage. Which of the following actions represents the most accurate and compliant approach to completing this Medigap application? Option A. Complete the application but leave the section regarding current Medicare enrollment blank, noting that the client is unsure of their status. Option B. Immediately halt the application process and explain to the client that they cannot enroll in a Medigap policy while actively enrolled in a Medicare Advantage plan, and then assist them in disengaging from their Medicare Advantage plan if they wish to pursue Medigap. Option C. Proceed with completing the application as submitted, assuming the client is aware of their Medicare enrollment and eligibility for Medigap. Option D. Advise the client to contact Medicare directly to determine their eligibility for Medigap, and then complete the application based on the information the client provides from that call. The correct answer is C. Proceed with completing the application as submitted, assuming the client is aware of their Medicare enrollment and eligibility for Medigap. Explanation. Scenario analysis. This scenario is professionally challenging because accurately completing Medigap applications is foundational to ensuring beneficiaries receive the correct coverage and to maintaining compliance with Centers for Medicare and Medicaid Services, CMS, regulation. Errors can lead to claim denials, policy rescissions, and potential penalties for both the agent and the insurance company. The complexity arises from the detailed nature of Medigap plans, the specific eligibility requirements, and the need to clearly explain options to a vulnerable population. Agents must exercise meticulous attention to detail and a thorough understanding of the product and regulatory landscape. Correct approach analysis. The correct approach involves the agent meticulously reviewing the applicant's existing Medicare coverage, Part A and Part B, and confirming their eligibility for Medigap. This includes verifying that the applicant is not enrolled in a Medicare Advantage plan, as Medigap policies are not compatible with Medicare Advantage. The agent must then accurately record the applicant's personal information, health status, if required by the specific plan and state regulations for underwriting, and the chosen Medigap plan. Crucially, the agent must ensure all questions on the application are answered truthfully and completely, and that the applicant understands the information they are providing and signing. This aligns with CMS guidelines for Medigap sales, which emphasize accurate enrollment and preventing misrepresentation. Ethical practice dictates full disclosure and accurate representation to the applicant and the insurer. Incorrect approaches analysis. One incorrect approach involves the agent assuming the applicant's eligibility and proceeding with the application without verifying their current Medicare enrollment status. This fails to adhere to CMS rules that prohibit individuals enrolled in Medicare Advantage from enrolling in Medigap. It also risks enrolling the applicant in a policy they cannot use, leading to significant consumer harm and potential regulatory action. Another incorrect approach is to rush through the application, leaving some fields blank or making assumptions about answers, especially regarding health questions if applicable for underwriting. This directly violates the requirement for complete and accurate applications. CMS mandates that all information be truthful and complete to ensure proper underwriting and policy issuance. Incomplete or misrepresented information can lead to policy rescission, which is detrimental to the beneficiary and a violation of sales practice standards. A third incorrect approach is to fail to clearly explain the Medigap plan benefits and limitations to the applicant, or to misrepresent the coverage. While this question focuses on application completion, the process is intertwined with the sales presentation. If the application is completed based on a misunderstanding or misrepresentation during the sales process, it is still an inaccurate application from a functional perspective. This violates the principle of informed consent and can lead to beneficiary dissatisfaction and regulatory scrutiny for misleading sales practices. Professional reasoning. Professionals should approach Medigap applications with a systematic process. First, confirm applicant eligibility by verifying Medicare enrollment status and understanding their current coverage. Second, conduct a thorough needs assessment to recommend the most appropriate Medigap plan. Third, meticulously complete the application, ensuring all fields are accurately filled and that the applicant understands each question and provides truthful answers. Fourth, clearly explain the policy benefits, limitations, and the application process to the applicant, obtaining their informed consent and signature. Finally, submit the accurate application promptly to the insurance carrier. This structured approach minimizes errors, ensures compliance, and upholds ethical obligations to the client and regulatory bodies. Question 6. Quality control measures reveal that a prospective Medicare supplement client, who has recently been diagnosed with a chronic condition and has had a lapse in prior health coverage for 3 months, is inquiring about immediate coverage for treatments related to this condition. As a Medicare supplement accredited advisor, how should you ethically and legally address this situation? Option A. Tell the client that pre-existing conditions are not a concern with Medicare supplement plans, and that they should simply enroll in the plan that offers the most comprehensive benefits. Option B. Advise the client to enroll in a Medicare Advantage plan instead, as these plans do not have pre-existing condition limitations, without further discussion of the client's specific needs or the differences between plan types. Option C. Explain the standard Medicare supplement pre-existing condition limitation, including the look-back period and the potential for a 6-month waiting period if credible coverage was not continuous, and advise the client to review the specific policy's outline of coverage. Option D. Assure the client that their new Medicare supplement plan will cover all treatments for their diagnosed condition from the effective date of the policy, regardless of prior coverage status. The correct answer is C. Explain the standard Medicare supplement pre-existing condition limitation, including the look-back period and the potential for a 6-month waiting period if creditable coverage was not continuous, and advise the client to review the specific policy's outline of coverage. Explanation. This scenario presents a professional challenge because it requires balancing a client's immediate desire for coverage with the strict regulatory limitations on pre-existing conditions in Medicare supplement plans. The advisor must navigate the ethical imperative to serve the client's best interests while adhering to federal laws and guidelines governing Medicare supplement insurance, specifically the Centers for Medicare and Medicaid Services, CMS, regulations. Misinterpreting or misrepresenting these limitations can lead to significant client dissatisfaction, regulatory penalties, and damage to the advisor's professional reputation. The correct approach involves clearly and accurately explaining the pre-existing condition limitation to the client, including the look-back period and the potential for a 6-month waiting period if the client has had a lapse in creditable coverage. This approach is right because it aligns with the legal requirements of the Medicare Supplement Program, which mandates that insurers can impose a pre-existing condition exclusion for up to 6 months for conditions treated within the 6 months prior to enrollment, provided the policy is issued during an open enrollment period or guaranteed issue period. Transparency about these limitations is an ethical obligation, ensuring the client makes an informed decision. This adheres to the principles of honesty and full disclosure expected of a Medicare supplement accredited advisor. An incorrect approach would be to assure the client that their condition will be covered immediately, despite the potential for a pre-existing condition limitation. This is a regulatory failure because it misrepresents the terms of the Medicare supplement policy and violates CMS guidelines regarding accurate information dissemination. Ethically, it is a breach of trust and fiduciary duty. Another incorrect approach would be to avoid discussing pre-existing conditions altogether, hoping the issue will resolve itself or that the client will not inquire further. This is a failure to provide essential information, which is a regulatory and ethical lapse. Advisors are expected to proactively educate clients about policy limitations. Finally, an incorrect approach would be to suggest the client enroll in a Medicare Advantage plan solely to bypass the pre-existing condition limitation, without a thorough assessment of whether Medicare Advantage is truly the best fit for the client's needs and budget. While Medicare Advantage plans generally cannot deny coverage for pre-existing conditions, steering a client inappropriately is an ethical failure and potentially a violation of sales practice regulations. The professional decision-making process for similar situations requires a commitment to understanding and applying CMS regulations regarding Medicare supplement plans. Advisors should prioritize client education, ensuring they fully comprehend policy benefits and limitations, including pre-existing condition clauses. When faced with client inquiries about pre-existing conditions, advisors must consult the specific policy's terms and relevant federal regulations to provide accurate information and guide the client toward an informed enrollment decision that meets both their healthcare needs and regulatory requirements. Question 7. The monitoring system demonstrates a beneficiary has contacted their Medicare supplement accredited advisor requesting to disenroll from their current Medicare Advantage plan and return to original Medicare. The beneficiary states they are unhappy with their current plan's provider network and prescription drug formulary. The advisor needs to determine the appropriate disenrollment pathway and effective date. Option A. Inform the beneficiary that disenrollment from a Medicare Advantage plan is only permitted during the annual election period, EAP, or if they qualify for a specific special enrollment period, SEP, and guide them on the applicable SEP based on their stated reasons for dissatisfaction. Option B. Advise the beneficiary that they can disenroll from their Medicare Advantage plan and return to original Medicare at any time they are dissatisfied with their current plan's offerings. Option C. Instruct the beneficiary to immediately disenroll from their Medicare Advantage plan and enroll in a new Medicare Advantage plan, assuming this will resolve their network and formulary concerns. Option D. Tell the beneficiary that they must remain in their current Medicare Advantage plan for the remainder of the contract year and cannot disenroll until the next annual election period, regardless of their dissatisfaction. The correct answer is B. Advise the beneficiary that they can disenroll from their Medicare Advantage plan and return to original Medicare at any time they are dissatisfied with their current plan's offerings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an advisor to navigate the complex and time-sensitive rules surrounding Medicare Advantage disenrollment periods. Misinterpreting these periods can lead to beneficiaries being unable to enroll in a plan that better suits their needs or being enrolled in a plan they did not intend to join, potentially causing financial hardship or inadequate coverage. The advisor must possess a thorough understanding of the specific disenrollment rights and the associated timelines to provide accurate guidance and prevent compliance issues. Correct approach analysis. The correct approach involves accurately identifying the beneficiary's eligibility for a special enrollment period, SEP, based on the specific circumstances of their request. This requires a deep understanding of the Centers for Medicare and Medicaid Services, CMS, regulations governing Medicare Advantage disenrollment. For instance, if a beneficiary is requesting to disenroll during the annual election period, EAP, to return to original Medicare, the advisor must confirm they are within the AEP timeframe and understand that this disenrollment will be effective at the end of the AEP. If the request is outside the AEP and does not qualify for a specific SEP, the advisor must clearly communicate that disenrollment is not permitted at that time, except during the next AEP or if a qualifying SEP arises. This adherence to CMS guidelines ensures the beneficiary's rights are protected and the advisor remains compliant. Incorrect approach is analysis. One incorrect approach is to assume that a beneficiary can disenroll from a Medicare Advantage plan at any time. This fails to recognize the structured enrollment and disenrollment periods established by CMS, such as the AEP and various SEPs. This approach violates regulations by misinforming the beneficiary about their enrollment rights and potentially leading to improper disenrollment or failure to enroll when eligible. Another incorrect approach is to advise the beneficiary that they can disenroll and enroll in a new Medicare Advantage plan immediately, regardless of the current election period. This overlooks the effective dates of disenrollment and enrollment, which are tied to specific periods and can have gaps in coverage or unintended enrollments. This can lead to non-compliance with CMS enrollment rules and potentially leave the beneficiary without adequate coverage or enrolled in a plan they did not intend. A third incorrect approach is to suggest that the beneficiary can simply switch back to original Medicare without considering the specific disenrollment pathways. While returning to original Medicare is an option, it must be done during an eligible period, such as the AEP or a qualifying SEP. Advising otherwise ignores the regulatory framework for such transitions and can result in the beneficiary being unable to make the desired change or facing unexpected consequences. Professional reasoning. Professionals should approach Medicare Advantage disenrollment inquiries by first confirming the beneficiary's current plan and the date of their request. They should then consult the most current CMS guidance on Medicare Advantage enrollment and disenrollment periods, paying close attention to the AEP, Medicare Advantage Open Enrollment Period, MAOEP, and all applicable SEPs. The advisor must ask clarifying questions to understand the beneficiary's reasons for wanting to disenroll and match those reasons to specific regulatory provisions. If the beneficiary's request does not align with an eligible disenrollment period, the advisor must clearly explain the limitations and advise on when disenrollment or a change in coverage would be permissible. Maintaining accurate records of these consultations is also crucial for compliance. Question 8. The control framework reveals that a client who is turning 65 in 3 months and is not currently working or covered by employer-sponsored health insurance is approaching their Medicare Part B enrollment window. The client has expressed a general interest in enrolling, but has not inquired about specific deadlines or potential penalties. As a Medicare Supplement Accredited Advisor, MSAA, what is the most appropriate course of action to ensure the client makes an informed decision regarding Part B coverage? Option A. Advise the client to enroll in Medicare Part B during their initial enrollment period, EAP, and clearly explain the potential for a late enrollment penalty if they delay enrollment without a qualifying special enrollment period, SEP. Option B. Recommend that the client wait until they are closer to retirement age or experience a change in employment status before enrolling in Medicare Part B to avoid any immediate administrative burden. Option C. Inform the client that they can enroll in Medicare Part B at any time through the General Enrollment Period, GEP, and that the exact enrollment date will not significantly impact their premium. Option D. Provide the client with a general overview of Medicare Part B benefits and suggest they research enrollment deadlines and penalties on their own to determine the best time to enroll. The correct answer is A. Advise the client to enroll in Medicare Part B during their initial enrollment period, EAP, and clearly explain the potential for a late enrollment penalty if they delay enrollment without a qualifying special enrollment period, SEP. Explanation. This scenario is professionally challenging because it requires an advisor to navigate the complexities of Medicare Part B enrollment periods and potential late enrollment penalties, directly impacting a client's future healthcare costs. The advisor must balance providing accurate information with understanding the client's specific circumstances and ensuring compliance with Medicare regulations. The core of the challenge lies in the advisor's responsibility to guide the client toward the most advantageous enrollment decision, while strictly adhering to the established enrollment timelines and penalty provisions outlined by Medicare. The correct approach involves proactively identifying the client's eligibility for Medicare Part B and clearly explaining the implications of the initial enrollment period, EAP, versus the general enrollment period, GEP, including the potential for a late enrollment penalty if enrollment is delayed without a special enrollment period, SEP. This approach is correct because it aligns with the MSAA's ethical obligation to act in the client's best interest by providing comprehensive and accurate information to prevent financial harm. Specifically, Medicare regulations mandate that individuals enrolling outside their IEP without a qualifying SEP will incur a lifetime premium increase. The advisor's duty is to inform the client of these consequences to enable an informed decision. An incorrect approach would be to simply advise the client to enroll whenever they feel ready, without detailing the specific enrollment periods and the associated late enrollment penalty. This fails to meet the fiduciary duty of an advisor, as it omits critical information that directly affects the client's financial well-being. Regulatory failure here is a lack of due diligence in informing the client about the direct financial consequences of delayed enrollment, which could lead to a significant, lifelong increase in their Medicare Part B premiums. Another incorrect approach would be to assume the client is aware of the enrollment deadlines and penalties, and to not bring up the topic proactively. This passive stance is a dereliction of the advisor's responsibility to educate and guide the client. The ethical failure is in not fulfilling the role of an accredited advisor who is expected to anticipate potential issues and provide proactive counsel. A third incorrect approach would be to advise the client to enroll in the GEP without explaining the late enrollment penalty, perhaps to avoid a potentially difficult conversation. This is a direct violation of the principle of full disclosure and transparency, which is fundamental to ethical advising. The regulatory failure is in not fully informing the client of all material aspects of their enrollment options, thereby potentially leading them to make a decision that is financially detrimental. The professional decision-making process for similar situations should involve a thorough understanding of Medicare enrollment rules, including IEPs, SEP, and the GEP, as well as the associated penalties. Advisors should always prioritize client education, ensuring that clients understand the implications of their enrollment choices. This includes proactively discussing potential financial consequences and exploring all available enrollment options based on the client's individual circumstances. A client-centered approach, grounded in regulatory compliance and ethical practice, is paramount. Question 9. The risk matrix shows a Medicare beneficiary currently enrolled in a Medigap policy is considering switching to a Medicare Advantage plan. What is the most crucial information the accredited advisor must convey to ensure the beneficiary understands the potential consequences of this decision regarding their future coverage options? Option A. The potential for lower monthly premiums and the broader network of providers typically available with Medicare Advantage plans compared to their current Medigap plan. Option B. The process for disenrolling from their Medigap policy and the typical timeline for their Medicare Advantage plan to become effective. Option C. The benefits of Medicare Advantage plans, such as prescription drug coverage and vision benefits, which may not be included in their current Medigap policy. Option D. The specific enrollment periods and guaranteed issue rights for switching from Medigap to Medicare Advantage, and the implications for re-enrolling in Medigap if they later wish to return to original Medicare. Correct answer is D. The specific enrollment periods and guaranteed issue rights for switching from Medigap to Medicare Advantage, and the implications for re-enrolling in Medigap if they later wish to return to original Medicare. Explanation. This scenario is professionally challenging because it requires an advisor to navigate complex Medicare rules regarding enrollment periods and potential loss of coverage when a beneficiary considers switching from a Medigap policy to a Medicare Advantage plan, and vice versa. The advisor must ensure the client understands the implications of such a switch, particularly concerning guaranteed issue rights and the potential for pre-existing condition exclusion. The advisor's primary ethical and regulatory duty is to provide accurate, unbiased information that allows the client to make an informed decision, prioritizing the client's best interests. The correct approach involves thoroughly explaining the enrollment periods and guaranteed issue rights associated with both Medigap and Medicare Advantage plans. This includes detailing when a beneficiary can enroll in or switch between these plans without medical underwriting, and the specific circumstances under which they might lose their Medigap coverage or be unable to re-enroll in a Medicare Advantage plan. The advisor must also highlight the potential risks of disenrolling from a Medigap plan before confirming enrollment in a Medicare Advantage plan, or vice versa, to prevent coverage gaps or the inability to regain prior coverage. This approach aligns with the MSAA's obligation to act in the client's best interest and adhere to Medicare regulations designed to protect beneficiaries. An incorrect approach would be to advise the client to disenroll from their Medigap plan immediately to enroll in a Medicare Advantage plan, without first verifying the client's eligibility for guaranteed enrollment in the Medicare Advantage plan, and understanding the implications for their ability to re-enroll in a Medigap policy later if they choose. This could lead to a loss of Medigap coverage and potential inability to obtain it again, especially if the client has health issues. Another incorrect approach would be to focus solely on the potential benefits of the Medicare Advantage plan without adequately explaining the loss of Medigap benefits and the limitations of Medicare Advantage plans, such as network restrictions and potential out-of-pocket maximums. Advising the client to switch without a clear understanding of their specific enrollment rights and the timing of these rights is a failure to provide comprehensive and accurate guidance, potentially violating regulatory requirements and ethical standards. The professional decision-making process for similar situations should involve a systematic review of the client's current coverage, their stated needs and preferences, and a detailed explanation of all available Medicare options, including the rules governing enrollment, disenrollment, and switching between plan types. The advisor must prioritize educating the client about their rights and the potential consequences of any change, ensuring the client can make a fully informed decision that best suits their individual circumstances and health needs. Question 10. Benchmark analysis indicates that individuals approaching Medicare eligibility often have questions regarding the optimal timing for enrolling in Medicare Part A to avoid potential financial penalties. A client, age 64 and 10 months, is currently covered by a robust employer-sponsored health insurance plan and is planning to retire in 6 months. They have expressed concern about understanding the implications of their upcoming Medicare Part A eligibility. Which of the following approaches best addresses the client's need for information and ensures they are positioned to make an informed decision regarding their Medicare Part A enrollment? Option A. Advise the client to wait until they retire and their employer coverage ends to enroll in Medicare Part A, as this is when they will need the coverage most. Option B. Explain the client's initial enrollment period (EAP) for Medicare Part A, detailing the specific months it encompasses relative to their 65th birthday, and discuss the potential for late enrollment penalties if enrollment is delayed beyond this period without a qualifying special enrollment period. Option C. Inform the client that their employer-sponsored health insurance will automatically coordinate with Medicare upon retirement, eliminating the need for them to actively enroll in Medicare Part A at this time. Option D. Recommend that the client immediately enroll in a Medicare supplement, Medigap, plan to secure future coverage options, as this is a proactive step for long-term health security. The correct answer is A. Advise the client to wait until they retire and their employer coverage ends to enroll in Medicare Part A, as this is when they will need the coverage most. Explanation. This scenario presents a professional challenge because it requires an MSAA to navigate the complexities of Medicare Part A enrollment for a client who is approaching eligibility, but has specific circumstances that could lead to enrollment delays or penalties. The challenge lies in accurately identifying the client's specific Medicare eligibility date and understanding the implications of different enrollment pathways, particularly the initial enrollment period, EAP, and special enrollment periods, SEP, to ensure the client avoids coverage gaps and potential late enrollment penalties. Careful judgment is required to balance providing comprehensive information with the client's immediate needs and potential future decisions. The correct approach involves proactively educating the client about their Medicare Part A eligibility, emphasizing the importance of enrolling during their initial enrollment period, EAP, to avoid late enrollment penalties. This approach is correct because it aligns with the Centers for Medicare and Medicaid Services, CMS, guidelines for Medicare enrollment, which are the sole regulatory framework for MSAAs operating within the U.S. Medicare system. Specifically, understanding the timing of the IEP, typically the 3 months before the month of turning 65, the month of turning 65, and the 3 months after, is crucial for preventing coverage gaps and financial penalties associated with delayed enrollment. Providing clear, actionable information about the enrollment process and potential SEP triggers empowers the client to make informed decisions. An incorrect approach would be to simply advise the client to wait until they are actively seeking coverage to enroll. This is ethically and regulatorily flawed because it fails to inform the client about the potential for late enrollment penalties for Part if they delay enrollment beyond their IEP without a qualifying SEP. This inaction could lead to significant financial disadvantages for the client and a breach of the MSAA's fiduciary duty to act in the client's best interest. Another incorrect approach would be to focus solely on Medicare supplement, Medigap, plans without first ensuring the client has secured their Medicare Part A coverage. This is problematic because Medigap plans are designed to work with original Medicare, Parts A and B. Without Part A, the client would have significant out-of-pocket costs for inpatient hospital services, and the Medigap policy would not be effective in covering those costs. Furthermore, enrolling in a Medigap plan without Part A could complicate future enrollment in a Medigap plan due to potential underwriting. A third incorrect approach would be to assume the client's employer-sponsored health insurance will automatically transition to Medicare coverage upon retirement without verifying the specific details of their current coverage and its interaction with Medicare. While some employer plans may coordinate with Medicare, others may not provide the same level of coverage or may have specific enrollment requirements that must be met to avoid penalties. Relying on assumptions rather than direct verification can lead to critical coverage gaps. The professional decision-making process for similar situations should involve a thorough assessment of the client's current health insurance situation, their upcoming Medicare eligibility date, and any potential qualifying events for special enrollment periods. The MSAA must then provide clear, accurate, and comprehensive information about Medicare Parts A and B enrollment, including the timing of enrollment periods, potential penalties, and the benefits of enrolling promptly. The focus should always be on empowering the client with knowledge to make the best choices for their healthcare coverage, adhering strictly to CMS regulations and ethical standards. Question 11. The evaluation methodology shows that when presenting Medicare supplement insurance options to a beneficiary, an advisor must avoid misleading or deceptive practices. Which of the following approaches best aligns with these requirements? Option A. Focus primarily on the low monthly premium of the Medicare supplement plan, with only a brief mention of the benefits. Option B. Guarantee that the beneficiary will have zero out-of-pocket costs for all medical services once enrolled in the Medicare supplement plan. Option C. Accurately describe the benefits covered by the Medicare supplement plan, clearly stating what it covers and does not cover, and emphasizing that it is designed to work alongside original Medicare. Option D. Present the Medicare supplement plan as a superior alternative to original Medicare that will replace the beneficiary's current Medicare coverage. The correct answer is C. Accurately describe the benefits covered by the Medicare supplement plan, clearly stating what it covers and does not cover, and emphasizing that it is designed to work alongside original Medicare. Explanation. This scenario is professionally challenging because it requires an advisor to navigate the fine line between highlighting the benefits of a Medicare supplement plan and making statements that could be interpreted as guarantees or misrepresentations of coverage. The advisor must ensure all communications are accurate, not misleading, and fully compliant with CMS regulations and state insurance laws governing Medicare supplement sales. The core challenge lies in presenting information in a way that is both persuasive and truthful, avoiding any language that could create false expectations for beneficiaries. The correct approach involves accurately describing the benefits of the Medicare supplement plan, clearly stating what it covers and what it does not, and emphasizing that it is designed to work alongside original Medicare. This approach is right because it adheres to the fundamental principle of full and fair disclosure required by CMS and state insurance departments. Specifically, regulations prohibit making misleading statements, guaranteeing benefits not provided by the policy, or misrepresenting the nature of the coverage. By focusing on factual descriptions and avoiding guarantees, the advisor upholds ethical standards and regulatory compliance, ensuring the beneficiary makes an informed decision based on accurate information. An incorrect approach that guarantees specific out-of-pocket costs will be eliminated by the plan is professionally unacceptable. This is a direct violation of regulations that prohibit guaranteeing benefits or coverage beyond what the policy explicitly states. Medicare supplement plans pay after Medicare, and while they reduce out-of-pocket costs, they cannot guarantee zero out-of-pocket expenses for all potential medical scenarios. Such a guarantee is misleading and creates unrealistic expectations, potentially leading to beneficiary dissatisfaction and regulatory action. Another incorrect approach that implies the plan is a better version of original Medicare or a replacement for it is also professionally unacceptable. Medicare supplement plans are standardized and designed to supplement, not replace, original Medicare. Misrepresenting the plan's relationship to Medicare can confuse beneficiaries about their fundamental coverage and lead them to make decisions that do not align with their actual healthcare needs. This misrepresentation violates the requirement for clear and accurate communication about the product's function. A third incorrect approach that focuses solely on the monthly premium without adequately explaining the benefits and limitations of the plan is also professionally unacceptable. While premium is a crucial factor, omitting or downplaying the coverage details and the fact that the plan works with original Medicare is a form of omission that can be misleading. Beneficiaries need a comprehensive understanding of both the cost and the value proposition to make an informed choice. The professional decision-making process for similar situations should involve a commitment to transparency and accuracy. Advisors should always ask themselves, is this statement factually correct and verifiable according to the policy and Medicare rules? And could this statement be misinterpreted by a beneficiary to create a false impression about coverage or costs? They should also consult official CMS guidelines and their state's insurance department resources to ensure their sales practices are compliant. Prioritizing beneficiary understanding and informed consent over sales pressure is paramount. Question 12. System analysis indicates a Medicare supplement accredited advisor, MSAA, is consulting with a prospective client who is interested in a Medicare Advantage plan. The client expresses a desire for predictable monthly costs, but is also concerned about potential surprise expenses. The MSAA needs to assess which Medicare Advantage plan type would best align with these stated preferences while mitigating potential risks. Considering the inherent structures of Medicare Advantage plans, which of the following approaches would be most appropriate for the MSAA to recommend to the client? Option A. Suggest a Medicare Supplement Insurance (Medigap) policy, as these plans are specifically designed to fill the coverage gaps in original Medicare and provide predictable cost sharing. Option B. Focus on explaining the out-of-pocket maximums and network restrictions associated with HMO and PPO plans, and the provider acceptance requirements for PFFS plans, to ensure the client understands potential cost and access risks. Option C. Advise the client to enroll in a Medicare cost plan, as these plans are designed to supplement original Medicare and offer predictable costs without network restrictions. Option D. Recommend a prescription drug plan, PDP, as it offers predictable monthly costs and is separate from Medicare Advantage plan structures. The correct answer is D. Recommend a prescription drug plan, PDP, as it offers predictable monthly costs and is separate from Medicare Advantage plan structures. Explanation. This scenario presents a professional challenge because it requires an MSAA to navigate the complexities of Medicare Advantage plan structures and their implications for beneficiary risk, while adhering strictly to CMS regulations and ethical obligations. The advisor must assess the suitability of different plan types for a specific individual's needs and risk tolerance without misrepresenting plan benefits or creating unrealistic expectations. The core of the challenge lies in accurately conveying the trade-offs inherent in each plan type, particularly regarding network restrictions, out-of-pocket costs, and coverage variations, all within the bounds of CMS marketing and enrollment guidelines. The correct approach involves a thorough risk assessment that prioritizes the beneficiary's understanding of plan limitations and potential financial exposure. This means clearly explaining that Medicare Advantage plans, by their nature, often involve network restrictions, HMO, PPO, or specific coverage rules, PFFS, SNP, that can impact access to care and lead to higher out-of-pocket costs if those rules are not followed, or if care is sought outside the plan's framework. For example, explaining that a PFFS plan might require providers to accept the plan's terms for each visit, or that an HMO requires referrals for specialists, directly addresses potential risks. This approach aligns with CMS regulations that mandate accurate and unbiased information, ensuring beneficiaries can make informed choices that mitigate their personal financial and healthcare access risks. The ethical imperative is to act in the beneficiary's best interest, which includes safeguarding them from unexpected costs or access barriers. An incorrect approach would be to focus solely on the potential for lower monthly premiums without adequately disclosing the associated risks. For instance, recommending a PFFS plan without emphasizing the provider acceptance requirement or the potential for higher costs if a provider does not accept the plan's terms for that specific service is a significant regulatory and ethical failure. This misrepresents the plan's true cost and access structure, potentially leading to financial hardship for the beneficiary. Similarly, promoting an HMO or PPO without clearly explaining the importance of staying within the network and the consequences of out-of-network care, e.g., no coverage or significantly higher costs, violates CMS marketing rules and the duty of care. Another incorrect approach would be to oversimplify the coverage of special needs plans, SNP, without detailing the specific eligibility requirements and the limited scope of their benefits, potentially enrolling a beneficiary in a plan for which they are not qualified, or that does not meet their broader healthcare needs. A professional decision-making process for similar situations should begin with a comprehensive understanding of the beneficiary's health status, financial situation, and preferences. This information should then be used to evaluate the various Medicare Advantage plan types, HMO, PPO, PFFS, SNP, MSA against CMS guidelines and the beneficiary's specific needs. The advisor must then present a balanced overview of each relevant plan, highlighting both potential benefits and inherent risks, with a particular emphasis on out-of-pocket maximums, network limitations, and any specific coverage restrictions. Transparency regarding potential costs and access issues is paramount, ensuring the beneficiary can make an informed decision that aligns with their risk tolerance and healthcare requirements. Question 13. The assessment process reveals that a Medicare supplement accredited advisor's client, who is enrolled in a Medicare Part D plan, has been prescribed a medication that is not listed on the plan's formulary. The client is concerned about the cost and access to this medication. What is the most appropriate course of action for the advisor to take? Option A. Recommend that the client immediately switch to a different Medicare Part D plan that may cover the prescribed medication, without further investigation into the current plan's options. Option B. Inform the client that since the medication is not on the formulary, it is not covered by their Part D plan, and they will need to pay for it out of pocket. Option C. Suggest the client purchase the medication from an online pharmacy that offers lower prices, without verifying the legitimacy of the pharmacy or its impact on Part D coverage. Option D. Advise the client to discuss with their prescriber the possibility of obtaining a formulary exception or initiating a prior authorization request with the Part D plan, while also exploring alternative formulary medications with the prescriber. The correct answer is D. Advise the client to discuss with their prescriber the possibility of obtaining a formulary exception or initiating a prior authorization request with the Part D plan, while also exploring alternative formulary medications with the prescriber. Explanation. This scenario is professionally challenging because it requires an MSAA to navigate the complexities of Medicare Part D formularies and coverage rules to ensure a client receives appropriate and cost-effective medication. The challenge lies in balancing the client's immediate medication needs with the plan's established processes, such as prior authorization and step therapy, while adhering strictly to CMS regulations governing Medicare supplement accredited advisors. The correct approach involves thoroughly understanding the client's current medication regimen, identifying the specific Part D plan's formulary, and then proactively working with the prescriber to address any formulary restrictions or requirements. This includes exploring options like requesting a formulary exception, initiating the prior authorization process, or discussing alternative medications that are on the formulary and clinically appropriate. This approach is correct because it prioritizes the client's health and access to necessary medications, while operating within the legal and regulatory framework of Medicare Part D. It demonstrates a commitment to client advocacy and adherence to CMS guidelines, which mandate that advisors assist clients in understanding their benefits and navigating coverage rules. An incorrect approach would be to simply inform the client that their medication is not covered without exploring all available avenues. This fails to meet the professional obligation of an MSAA to assist clients in understanding and utilizing their Medicare benefits. It also overlooks the possibility of formulary exceptions or prior authorizations, which are designed to provide access to medically necessary drugs not on the standard formulary. Another incorrect approach would be to advise the client to switch to a different Part D plan without a comprehensive analysis of that plan's formulary and potential coverage gaps for the client's specific needs. This could lead to a different set of problems and does not address the immediate issue with the current plan. It bypasses the established processes for obtaining coverage for non-formulary drugs. A third incorrect approach would be to suggest the client purchase the medication out of pocket without investigating the plan's coverage options or the possibility of manufacturer assistance programs. While out-of-pocket payment might be a last resort, it should not be the initial recommendation when there are established pathways within Medicare Part D to secure coverage. This fails to leverage the benefits the client is entitled to. Professional decision-making in such situations requires a systematic process. First, understand the client's specific situation and medication needs. Second, thoroughly review the client's current Part D plan's formulary and coverage rules. Third, consult with the client's prescriber to understand the clinical necessity of the medication and explore potential alternatives or the prior authorization process. Fourth, clearly communicate all options and their implications to the client, empowering them to make an informed decision. Question 14. The control framework reveals that a Medicare beneficiary who is relatively healthy and budget-conscious is inquiring about Medigap plans. The advisor has access to a range of plans, some of which offer significantly higher commissions than others. The client expresses a desire for basic coverage that will help with predictable costs like deductibles and copayments, and mentions they are trying to keep their monthly expenses as low as possible. The advisor knows that a particular plan with a higher commission structure offers slightly more comprehensive benefits than a lower commission plan that would adequately meet the client's stated needs. Which of the following actions best demonstrates adherence to ethical and regulatory requirements for a Medicare supplement accredited advisor in this situation? Option A. Focus the discussion primarily on the features of the higher commission plan, downplaying the existence or relevance of less expensive alternatives. Option B. Recommend the Medigap plan that most comprehensively meets the client's stated needs for basic coverage and cost containment, even if it offers a lower commission. Option C. Recommend a Medigap plan without thoroughly explaining the differences in benefits and costs between it and other available options, assuming the client will understand. Option D. Recommend the Medigap plan with the highest commission potential, emphasizing its slightly broader benefits as a valuable long-term investment for the client. The correct answer is B. Recommend the Medigap plan that most comprehensively meets the client's stated needs for basic coverage and cost containment, even if it offers a lower commission. Explanation: this scenario is professionally challenging because it pits the advisor's potential financial gain against the client's best interest, a core ethical tenet in insurance advising. The advisor must navigate the temptation to steer a client towards a product that offers a higher commission, even if it's not the most suitable option for the client's specific needs and budget. This requires a high degree of integrity and adherence to regulatory standards designed to protect consumers. The correct approach involves prioritizing the client's needs above all else. This means conducting a thorough needs analysis, clearly explaining all available Medigap plan options, including their benefits, costs, and limitations, and recommending the plan that best aligns with the client's health status, financial situation, and preferences. This approach is ethically sound and compliant with regulations that mandate acting in the client's best interest and providing accurate, unbiased information. The advisor must ensure that any recommendation is based on a genuine assessment of the client's situation, not on the potential for increased compensation. An incorrect approach would be to subtly or overtly steer the client towards a more expensive plan that offers a higher commission, without fully disclosing the rationale or the existence of more cost-effective alternatives. This constitutes a breach of fiduciary duty and violates regulations that prohibit misrepresentation and deceptive practices. Another incorrect approach is to fail to adequately explain the differences between various Medigap plans, leaving the client ill-informed and vulnerable to making a suboptimal choice. This lack of transparency and comprehensive education is also a regulatory failure. Finally, an approach that prioritizes the advisor's personal financial goals over the client's well-being is fundamentally unethical and a direct violation of the principles of good practice expected of a Medicare supplement accredited advisor. The professional decision-making process for similar situations should involve a clear internal checklist. 1. Is this recommendation truly in the client's best interest? 2. Have I fully disclosed all relevant information, including potential conflicts of interest? 3. Am I recommending this product based on its suitability for the client or on my own potential gain? 4. Does this recommendation comply with all applicable Medicare supplement regulations and ethical guidelines? Question 15. The audit findings indicate that a Medicare supplement accredited advisor, MSAA, has been actively using social media platforms to promote Medigap plans. Which of the following strategies best aligns with regulatory requirements for marketing Medicare supplement insurance on social media? Option A. Sharing links to the official Medicare, Gov website and other government resources, with minimal original commentary from the MSAA. Option B. Developing and sharing original marketing content, including plan comparisons and benefit highlights, after obtaining prior approval from CMS and undergoing legal review for compliance. Option C. Utilizing client testimonials on social media to showcase positive experiences with Medigap coverage, without specific CMS pre-approval for the testimonials themselves. Option D. Posting general educational content about Medicare and Medigap plans, with a disclaimer that specific plan benefits vary, and individuals should consult official sources for details. Correct answer is D. Posting general educational content about Medicare and Medigap plans, with a disclaimer that specific plan benefits vary, and individuals should consult official sources for details. Explanation: This scenario presents a common implementation challenge for Medicare Supplement Accredited Advisors, MSAAs, navigating the complexities of digital marketing. The core challenge lies in balancing the need to reach potential clients through popular social media platforms with the strict regulatory requirements governing Medicare Supplement, Medigap marketing. MSAAs must ensure their online communications are accurate, not misleading, and comply with all applicable federal and state laws, particularly those enforced by the Centers for Medicare and Medicaid Services, CMS. The dynamic nature of social media, with its emphasis on brevity and engagement, can easily lead to unintentional violations if not managed with extreme care and adherence to established guidelines. The correct approach involves proactively seeking CMS approval for any marketing materials, including those intended for social media, and ensuring that all content is reviewed by legal counsel specializing in healthcare insurance marketing. This proactive stance is crucial because CMS has specific rules regarding what can and cannot be said in Medigap advertisements, including prohibitions against misleading statements, guaranteed benefits not offered by the plan, and misrepresentations of plan coverage. By obtaining prior approval and legal review, MSAAs demonstrate a commitment to compliance, minimizing the risk of violations and protecting both themselves and their clients. This aligns with the ethical obligation to provide accurate and transparent information. An incorrect approach that involves posting general information about Medicare and Medigap plans without specific CMS approval or legal review is problematic. This fails to meet the requirement for pre-approval of marketing materials and opens the door to inadvertently making claims or statements that could be construed as misleading or non-compliant with CMS regulations. Another incorrect approach, which is to use testimonials from beneficiaries without ensuring they are compliant with CMS guidelines regarding endorsements and disclosures, is also a significant failure. CMS has specific rules about how testimonials can be used to prevent them from being misleading or creating unrealistic expectations. Finally, an approach that relies solely on sharing links to official Medicare.gov resources without adding any original marketing content, while seemingly safe, may not be an effective marketing strategy and could be interpreted as a missed opportunity to engage potential clients with compliant, informative content that highlights the value of their services. However, the primary failure in this approach is not necessarily a direct regulatory violation, but rather a lack of proactive marketing effort that could still be improved through compliant content creation. The professional decision-making process for MSAAs in this context should involve a thorough understanding of CMS marketing guidelines for Medigap plans. Before engaging in any social media marketing, they should consult these guidelines and their organization's compliance department. When in doubt about the permissibility of any content, seeking pre-approval from CMS and legal counsel is paramount. This systematic approach ensures that marketing efforts are not only effective but also fully compliant, safeguarding against potential penalties and maintaining professional integrity. Question 16. System analysis indicates that a Medicare Supplement Accredited Advisor is meeting with a prospective client who has expressed a strong initial preference for a specific Medigap plan, Plan G, stating it's what their friend recommended. The client appears eager to finalize the application. However, based on the client's stated health concerns and budget, the advisor believes Plan F might offer better value and coverage for this individual. Though Plan F is not available to new Medicare beneficiaries in this state, the advisor also knows that Plan N is a viable alternative that offers significant cost savings with only minor out-of-pocket differences for the client's anticipated usage. The client has not asked about other plan options. What is the most appropriate course of action for the advisor? Option A. Strongly recommend Plan F, explaining why it is superior, and attempt to persuade the client to choose it over Plan G, highlighting its comprehensive coverage. Option B. Explain the differences between Plan G and Plan N, focusing on how Plan N might better align with the client's stated budget and health needs, while also clarifying why Plan F is not an option for them in this state. Option C. Proceed with the application for Plan G as requested by the client, assuming the client has done their research and is making an informed choice. Option D. Inform the client that Plan F is unavailable and then proceed with Plan G, as that was their initial request, without discussing Plan N. The correct answer is C. Proceed with the application for Plan G as requested by the client, assuming the client has done their research and is making an informed choice. Explanation. This scenario presents a professional challenge because it requires an advisor to navigate a conflict between a client's stated preference and the advisor's obligation to ensure the client understands and selects the most suitable Medicare supplement, Medigap, plan, adhering to state regulations. The advisor must balance client autonomy with their fiduciary duty and regulatory compliance. Careful judgment is required to avoid misrepresentation or undue influence while still guiding the client toward an informed decision. The correct approach involves patiently explaining the differences between the plans, focusing on how the client's stated needs and budget align with the benefits and costs of each option, and specifically addressing the state-mandated benefits and limitations. This approach prioritizes client education and informed consent, which are fundamental ethical and regulatory requirements for Medigap sales. By thoroughly explaining the plan features and ensuring the client understands the implications of their choice, the advisor fulfills their duty to act in the client's best interest and complies with state regulations that aim to protect consumers from making unsuitable or misunderstood policy choices. An incorrect approach would be to immediately process the client's initial request without further clarification or education. This fails to meet the regulatory requirement of ensuring the client understands the plan they are purchasing and may lead to the client selecting a plan that does not adequately meet their needs or budget, potentially violating state consumer protection laws. Another incorrect approach would be to strongly advocate for a specific plan that the advisor believes is best without adequately exploring the client's individual circumstances and preferences, or without clearly explaining why that plan is being recommended over others. This could be perceived as undue influence or a failure to present all suitable options objectively, contravening ethical guidelines and potentially state regulations regarding fair sales practices. Finally, simply providing brochures and expecting the client to make a fully informed decision without active guidance and explanation would also be an inadequate approach, as it shifts the entire burden of understanding complex insurance products onto the client, which is not consistent with the advisor's role and responsibilities. Professionals should employ a decision-making framework that begins with active listening to understand the client's stated needs and concerns. This is followed by a thorough needs assessment, where the advisor probes for more information to gain a comprehensive understanding of the client's health status, financial situation, and priorities. Next, the advisor should present a range of suitable Medigap plan options, clearly explaining the benefits, costs, and any state-specific variations. The process culminates in ensuring the client fully understands the chosen plan and has made an informed decision, with documentation to support the recommendation and the client's understanding. Question 17. Process analysis reveals that a Medicare beneficiary with original Medicare is interested in enrolling in a Medicare Advantage plan. They are unsure about the specific timing and eligibility requirements for making this change. What is the most appropriate course of action for a Medicare supplement accredited advisor to take? Option A. Recommend that the beneficiary disenroll from original Medicare first and then explore Medicare Advantage plan options. Option B. Suggest that the beneficiary contact Medicare directly to inquire about all available Medicare Advantage plans without providing any specific guidance on enrollment timing or eligibility. Option C. Explain the various Medicare Advantage enrollment periods, such as the initial enrollment period and the annual election period, and emphasize the importance of verifying the beneficiary's residence within the plan's service area before enrollment. Option D. Advise the beneficiary to enroll in the Medicare Advantage plan immediately, as they are eligible to switch from original Medicare at any time. The correct answer is D. Advise the beneficiary to enroll in the Medicare Advantage plan immediately, as they are eligible to switch from original Medicare at any time. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an advisor to navigate complex Medicare Advantage enrollment rules, specifically concerning an individual's eligibility and the timing of enrollment, while also considering the potential for unintended consequences like loss of existing coverage. Misinterpreting these rules can lead to significant enrollment errors, financial penalties for the beneficiary, and a loss of trust in the advisor. Accurate judgment is crucial to ensure the beneficiary makes informed decisions that align with their healthcare needs and Medicare regulations. Correct approach analysis. The correct approach involves thoroughly verifying the beneficiary's eligibility for Medicare Advantage based on their current Medicare status and geographic location, and then clearly explaining the available enrollment periods and their implications. This aligns with the MSAA's ethical obligation to provide accurate, unbiased information and to act in the beneficiary's best interest. Specifically, understanding that an individual with original Medicare can enroll in a Medicare Advantage plan during their initial enrollment period (EAP) or the annual election period (EAP), provided they reside in the plan service area, is paramount. Advising the beneficiary to confirm their specific IEP or AEP dates and to understand the plan's coverage and costs before enrolling is essential for informed consent and compliance with Medicare Advantage enrollment rules. Incorrect approach is analysis. One incorrect approach is to assume that because the individual has original Medicare, they can enroll in a Medicare Advantage plan at any time. This fails to recognize the specific enrollment periods mandated by Medicare, such as the IEP and AEP, and can lead to enrollment being denied or the beneficiary missing out on crucial coverage. This is a direct violation of providing accurate regulatory information. Another incorrect approach is to advise the beneficiary to enroll immediately without first confirming their eligibility for a specific Medicare Advantage plan service area. Medicare Advantage plans have defined service areas, and enrollment is restricted to individuals residing within those areas. Failing to verify this can result in enrollment in a plan that cannot provide coverage, leading to significant disruption and potential financial hardship for the beneficiary. This demonstrates a failure to adhere to the geographic restrictions of Medicare Advantage plans. A third incorrect approach is to focus solely on the potential benefits of a Medicare Advantage plan without adequately explaining the implications for their current original Medicare coverage. Enrolling in a Medicare Advantage plan typically means the beneficiary will disenroll from original Medicare. Failing to clearly communicate this transition and its potential impact on their current healthcare providers or prescription drug coverage is a failure to provide complete and transparent information, which is an ethical and regulatory requirement. Professional reasoning. Professionals should employ a decision-making framework that prioritizes understanding the beneficiary's current Medicare status, their geographic location, and the specific Medicare Advantage plan's rules. This involves a systematic review of eligibility criteria, enrollment periods, and plan benefits. The advisor must then communicate this information clearly and comprehensively, ensuring the beneficiary understands all implications before making a decision. This process upholds the principles of informed consent and regulatory compliance. Question 18. Strategic planning requires a Medicare supplement accredited advisor to assess a client's situation to ensure they can access appropriate coverage. A client informs you they are losing their employer-sponsored health insurance at the end of the month and are concerned about gaps in their Medicare coverage. They have original Medicare. What is the most critical first step in advising this client regarding Medigap options? Option A. Explain the benefits of Medicare Advantage plans as an alternative to Medigap. Option B. Determine if the client's current health conditions would qualify them for Medigap plans without underwriting. Option C. Recommend that the client wait until their employer coverage has officially ended before exploring new options. Option D. Advise the client on the specific Medigap plans that offer guaranteed issue rights due to losing employer coverage. The correct answer is B. Determine if the client's current health conditions would qualify them for Medigap plans without underwriting. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the advisor to navigate the complexities of Medicare supplement, Medigap, guaranteed issue rights, which are time-sensitive and have specific eligibility criteria. Misinterpreting these rights can lead to a client being unable to obtain coverage they are entitled to, causing significant financial and health implications. The advisor must possess a thorough understanding of federal and state regulations governing these rights to provide accurate guidance and ensure the client's best interests are met. Correct approach analysis. The correct approach involves accurately identifying the client's specific situation and determining if it triggers a guaranteed issue right under federal law or applicable state regulations. This requires understanding the various scenarios that grant these rights, such as losing other health coverage, moving out of a planned service area, or the insurer going bankrupt. The advisor must then guide the client on the specific Medigap plans available under that right and the enrollment periods. This approach is correct because it directly adheres to the Medicare Supplement Insurance, Medigap, regulations, specifically the provisions designed to protect beneficiaries by ensuring access to coverage without medical underwriting in certain circumstances. Incorrect approach is analysis, an approach that focuses solely on the client's current health status without first verifying if a guaranteed issue right exists is incorrect. This fails to recognize that guaranteed issue rights bypass medical underwriting. It is a regulatory failure because it ignores the core purpose of these rights, which is to provide a safety net for beneficiaries who lose other coverage. An approach that assumes all Medigap plans are available under any guaranteed issue right is incorrect. While guaranteed issue rights offer access to specific plans, not all plans are necessarily available in every situation or state. This is a regulatory failure as it misrepresents the scope of the guaranteed issue right, potentially leading the client to believe they have more options than they actually do. An approach that delays providing information or guidance until the client has exhausted all other coverage options is incorrect. Guaranteed issue rights are often triggered by specific events and have enrollment windows. Procrastination can cause the client to miss these critical deadlines, thereby forfeiting their right to guaranteed issue coverage. This is an ethical and regulatory failure, as it neglects the advisor's duty to act in the client's best interest and to provide timely and accurate information. Professional reasoning. Professionals should employ a decision-making framework that prioritizes understanding the client's circumstances in relation to established regulatory frameworks. This involves 1. Active listening to gather all relevant details about the client's current and past coverage. 2. Consulting the specific Medicare supplement insurance, Medigap, regulations, and any relevant state-specific laws to identify potential guaranteed issue triggers. 3. Clearly explaining to the client which specific guaranteed issue rights, if any, they qualify for, and the associated enrollment periods and available plans. 4. Documenting the advice provided and the client's decisions. Question 19. What factors determine the appropriate sequence and required documentation for submitting a Medigap claim when a beneficiary also has coverage under a Medicare Advantage plan or other primary insurance? Option A. The availability of the beneficiary's medical records and the discretion of the claims processor. Option B. The most recent marketing materials from the Medigap provider and general insurance industry best practices. Option C. The specific Medigap policy's benefit structure and the order of operations dictated by Medicare's coordination of benefits rules. Option D. The beneficiary's personal preference for claim submission and the insurer's internal processing speed. Correct answer is C. The specific Medigap policy's benefit structure and the order of operations dictated by Medicare's coordination of benefits rules. Explanation. This scenario presents a professional challenge because Medicare supplement, Medigap, claims processing involves navigating complex federal regulations and ensuring accurate reimbursement for beneficiaries while adhering to insurer policies. The MSAA's role is to facilitate this process, requiring a deep understanding of how claims are adjudicated and the potential pitfalls that can lead to delays or denials. The challenge lies in balancing the beneficiary's need for timely payment with the insurer's obligation to process claims according to established guidelines, all within the strict framework of Medicare rules. The correct approach involves understanding and applying the specific Medicare guidelines for Medigap claims, including timely filing limits, required documentation, and coordination of benefits with Medicare Part A and Part B. This ensures that claims are submitted accurately and efficiently, minimizing the risk of denial and maximizing the likelihood of prompt payment for the beneficiary. Adherence to these regulations is paramount for maintaining compliance and upholding the integrity of the Medicare program. An incorrect approach would be to assume that all claims are processed identically without considering the nuances of Medigap policies and Medicare's administrative rules. This could lead to overlooking specific documentation requirements or failing to account for the order in which claims should be submitted when other insurance is involved, resulting in claim rejections. Another incorrect approach would be to prioritize speed over accuracy, potentially submitting incomplete or inaccurate information, which would inevitably lead to claim denials and further delays, ultimately harming the beneficiary. Relying solely on anecdotal experience or general insurance processing knowledge without referencing the specific Medicare supplement insurance, MSAA, regulations would also be a significant failure, as Medigap operates under a distinct set of rules. Professionals should approach Medigap claims processing by first thoroughly reviewing the specific Medigap plan's benefits and limitations, then consulting the relevant Medicare administrative rules and guidelines for claim submission and adjudication. This systematic approach grounded in regulatory knowledge, ensures that all requirements are met, thereby facilitating a smooth and compliant claims process for the beneficiary. Question 20. Examination of the data shows a Medicare beneficiary is concerned about the monthly cost of Medicare Advantage plans, stating they can't afford a high premium. They are seeking guidance on how to manage their healthcare expenses effectively. Which of the following approaches best addresses their concerns while adhering to regulatory requirements for Medicare Supplement accredited advisors? Option A. Emphasize the potential for lower out-of-pocket costs in Medicare Advantage compared to original Medicare, without detailing the specific copayment and coinsurance structures. Option B. Focus exclusively on identifying Medicare Advantage plans with the lowest monthly premiums, assuring the beneficiary that this will be the most cost-effective option. Option C. Highlight the out-of-pocket maximum for each plan as the primary cost consideration, suggesting that this figure represents the total annual healthcare expense. Option D. Explain the various cost components of Medicare Advantage plans, including monthly premiums, deductibles, copayments, and coinsurance, and discuss how these can vary by plan and service utilization, while also highlighting the out-of-pocket maximum. The correct answer is D. Explain the various cost components of Medicare Advantage plans, including monthly premiums, deductibles, copayments, and coinsurance, and discuss how these can vary by plan and service utilization, while also highlighting the out-of-pocket maximum. Explanation. This scenario is professionally challenging because it requires an advisor to balance the client's immediate financial concerns with the long-term implications of Medicare Advantage cost structures. Advisors must navigate the complexities of premiums, deductibles, copayments, and coinsurance, ensuring the client understands not just the initial outlay, but also potential out-of-pocket expenses throughout the year. Misinterpreting or oversimplifying these costs can lead to significant financial distress for the client and potential regulatory violations for the advisor. The correct approach involves clearly explaining the different cost components of Medicare Advantage plans, emphasizing how each contributes to the overall financial picture. This includes detailing the structure of monthly premiums, the annual deductible, if applicable, and the per-service copayments or coinsurance. Crucially, it requires illustrating how these costs can vary based on the services utilized and the specific plan chosen, and highlighting the existence of out-of-pocket maximums as a protective measure. This approach aligns with the MSAA's ethical obligation to provide accurate, comprehensive, and understandable information to beneficiaries, enabling informed decision-making and fulfilling the duty of care. An incorrect approach that focuses solely on the monthly premium overlooks the significant impact of deductibles, copayments, and coinsurance on a beneficiary's total annual healthcare spending. This failure to present a complete cost picture is misleading and violates the principle of full disclosure. Another incorrect approach that emphasizes only the potential for lower initial costs without adequately explaining the variability of copayments and coinsurance fails to prepare the client for potential fluctuations in out-of-pocket expenses, potentially leading to unexpected financial burdens. This omission can be seen as a failure to provide adequate guidance. A third incorrect approach that prioritizes a plan with the lowest out-of-pocket maximum without considering the monthly premium and the likelihood of incurring significant healthcare costs throughout the year is also flawed. While the maximum is a safeguard, it does not reflect the typical annual expenditure and can lead to a plan that is unaffordable on a monthly basis or does not offer the best value for the client's expected healthcare needs. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's healthcare needs and financial situation. This involves actively listening to the client's concerns about costs and then systematically breaking down the cost structures of various Medicare Advantage plans. The advisor should use clear, non-technical language, provide illustrative examples, and ensure the client understands the trade-offs between different plan features and their associated costs. The focus should always be on empowering the client with the knowledge to make a choice that best suits their individual circumstances, rather than pushing a particular plan.